Hello, medicos. Welcome to my channel where you can learn XYZs of anesthesia and clinical studies. Today we are going to learn all about diabetes mellitus. It is a chronic condition where the body either doesn't produce enough insulin or can't use it effectively, leading to high blood sugar levels. There are two classifications of diabetes. Type 1 diabetes mellitus. It is often caused by the autoimmune destruction of beta cell, which lies in pancreas. What cells actually attack our own tissues?
Common autoantibodies include anti-GD, anti-IA2, and anti-insulin antibodies. These are immune proteins produced by the body that mistakenly attack its own tissues.
But what is the onset?
Onset of action often starts in childhood or adolescence, but it can also develop in adults as latent autoimmune diabetes. It was classified under type 1 DM because it involves the autoimmune destruction of beta cells. But it progresses more slowly and initially mimics type 2 diabetes in them.
What about the mechanism of action?
In type 1 diabetes, due to the destruction of beta cells, there is little to no insulin available in the bloodstream. Without insulin, the glucose transporters are not activated, preventing glucose from entering the cells.
Without insulin, glucose uptake by cells is impaired, so it stays in the bloodstream, leading to hyperglycemia. Simultaneously, the liver doesn't sense the high blood glucose due to the absence of insulin signals, so it continues to produce and release more glucose, worsening hyperglycemia. The cells, especially those in muscles and fat, are deprived of glucose, leading to an energy deficit. This is why insulin deficiency leads directly to the impaired glucose uptake and the symptoms of hyperglycemia seen in type 1 diabetes, like fatigue, frequent urination, and excessive thirst. Then, the liver continues to produce glucose in response to the lack of insulin, exacerbating hyperglycemia. In response to the energy deficit caused by glucose being unable to enter cells, the body breaks down fat for fuel, producing ketones. High levels of ketones can lead to diabetic ketoacidosis, a life-threatening condition if untreated. Since the body cannot produce insulin, individuals with type 1 diabetes mellitus need external insulin administration to control blood sugar levels, promote glucose uptake, and prevent complications.
To break down the mechanism. First comes an autoimmune destruction of beta cells and insulin deficiency, impaired glucose uptake, hyperglycemia, increased glucose production by liver, fat breakdown and ketosis, and treatment with insulin. Just try to remember the mnemonic of this mechanism. An ice and ice creams are highly increased and flavors are tasty. In our next video, we will cover the second classification of diabetes, its causes, onset of action, mechanism and symptoms, and other specific types of diabetes, its pathophysiology, clinical features, diagnosis, management, and many more. Stay tuned to our channel, and if you need the full notes of XYZs of diabetes mellitus, comment as a PDF. Don't forget to subscribe our channel. Thank you for watching.